Case counts and hospital capacity are very important factors in determining how much we can reopen, but they're not the only.
Certainly a much more interactive media availability for Medical Officer of Health, Dr. Jim Chirico, on this Monday morning. He brought along several other medical professionals during a Microsoft Teams virtual media availability on this Monday. There was a question and answer period, and during that time, I asked Dr. Chirico about the confusing Cassellholme test results, and he directed that question on to one of his colleagues, Chief Nursing Officer Shannon Mantha. She said this about the Cassellholme testing issue.
Because there was some question around some of the lab results, some individuals had tested positive, and there was some question and further discussion and clarification required regarding those positive results. So what we did in conjunction with our with Cassellholme is we consulted with experts in laboratory medicine at both the North Bay Regional Health Centre as well as Public Health Ontario to better understand the test results of some of the individuals that were tested, as they really weren't straightforward. And we are often asked, or since then we've often been asked, were the results false positives? And so the answer to that is no, the results were not false positives. And following consultation with the experts I mentioned earlier in laboratory medicine, as well as infectious disease experts, we did make the collective determination that these test results were positive, and then we managed them accordingly, which is why the outbreak was declared and sustained.
Also discussed vaccine rollout from homeless individuals to first responders. Many key details were made available on this Monday morning.
As of this morning, we have administered a total of 4,467 vaccines in our district. We actually received a shipment of vaccine this morning, and we have been provided with allocations of vaccine on a weekly basis for the next 4 weeks, which will allow us to plan for the clinics that we're working on and have a sense of how much vaccine we're going to have for distribution over the next month or so.
Vaccine priority has been given to long-term care home residents and staff, healthcare workers, and First Nation communities.
The ministry has created a guidance document that we are following that outlines the order of vaccination that will happen in those areas. And so we are collecting that information. We are planning clinics, and now with having the vaccination information available regarding the number of doses that we're going to be receiving in the course of the next month or so, we hope to be able to roll out those clinics in the next few weeks.
On this Monday, it was revealed that weekly press conferences will be held through this virtual platform every Thursday morning at 10 a.m. and your TV jumped on that availability, as we will broadcast those media conferences live on our channel. So every Thursday morning at 10 a.m., circle your calendars with a red marker. Reporting from Oak Street, I'm Clarke Heipel for Cogeco News. Back to Greg at the news desk.